So,
Sorry, I didn't mean to throw you off.
so you guys know that that's like my why for why I live my life, why I do the things I do. Michael and Ron, come sit. But what you may not know is the why that I've been at the practice I've been managing for 20 years. And the biggest part of that why, and she's going to be super embarrassed because I told her I wasn't going to do this, but I am. The biggest part of that why is standing right next to me. So most of you have met, yes, Ron.
It's Michael Carly.
Most of you have met Dr. Corey or Steph, as I call her when we're not doing business things. But she is the reason that I stay at our office. You know, Robbie brought up a thing today in his education moment where he was talking about how you need a technician, you need an entrepreneur, and you need a manager. And I looked over at Steph and she got it too. And she looked at me and I was like, that's what we did. We did that together. We took a business that had one person trying to do all three of those things and turned it into a business where her and I and Chris, our CFO, who's not here right now, have done that. And it's created a magical thing for us. So her willingness to be that entrepreneurial brain and her willingness to see that you really need that team of three to make things work. We always call it our pyramid at the office, has really made my life wonderful and has really made our practice grow. So anyway, she is the why that I am with the White Crane Clinic still.
Thank you. That's really nice.
I know. Till I move to Alaska.
Say that to me at the office.
Actually, I do. I text her all the time, usually drunkenly. I love you. So I wanted to do a visual today. A lot of you who have never been to the office may never have seen acupuncture get done. I also thought it would be beneficial to bring in the two biggest babies in our chapter. So you can see that if they can get through it, you can get through it too. Just so you can understand some misconceptions about acupuncture. I'm also grabbing right now, I'm grabbing a small gauge hypodermic needle, and I'm grabbing acupuncture needles because I'm going to pass around on each side. I want you to see the difference in needle size. So when most people are thinking about getting needles put in them, they're thinking of a hypodermic needle. And this is a relatively small gauge hypodermic needle. We actually only use these to draw out Scotty's B12 or B complex injections. And then we put a much smaller gauge needle on there before we inject it. But this is a standard injection gauge needle. You go to the doctor and you get a vaccine, you get something, this is the size that they're using. This packet here has acupuncture needles in it. And you can see that if you put all of those acupuncture needles together, like made them into one, they still wouldn't be as big as this hypodermic needle. So I'm going to pass these around so you guys can see the difference in needle gauge so that you know what you're getting into. The other thing, you take those and then pass them around. Thank you. The other thing I want you guys to know is that acupuncturists, especially in Florida, not in every state, but especially in Florida, are considered primary care physicians. Dr. Corey went to school for a ridiculous amount of years in order to be able to do this. So they have biomed training, they have acupuncture training, they have the same like musculoskeletal anatomy training. They have so much training, and then they take 4 board exams that they have to pass in order to become licensed in the state of Florida. One of them is completely in Chinese, so that's just insane to me, but they have to pass that one as well. So we're not just getting a certificate and deciding that we're going to do some sort of medical treatment on you. It's very much a lot of schooling, a lot of knowledge goes into being able to do this. Now, Ron comes in to get treated for his shoulder. Michael Carly's coming in to get treated for that wrist that he took a tumble. Way to go, Tim Earhart, for that one. So I'm going to let Dr. Corey explain what happens when she puts the needles in these 2 spots, if you don't mind. It'll be better coming for you. Less made up.
I'd prefer to hear it.
Less made up.
Okay, so anything you could see a primary care doctor for is something you could see an acupuncturist for. So I would say pain management is probably the #1 thing that we treat. It's probably about 80% of what I specifically do in my clinic, but overall, probably 95% of what we do is pain management. So there's 2,000 points on the body. So our job is to figure out which 15 to 20 points we're going to do and why we're going to do them. So we'll kind of start with Ron over here. He has a shoulder injury he's had for a couple years. It's something that is chronic now. So the points that we're doing right now, at least for now, are local points. So what we're doing is we're creating small micro tears in the skin. You may feel some of the needles. People say you don't always feel them. You may feel some of them. They're really, my youngest patient is 6. So she does okay too. So there are patients who can lay there and get needles, and it's really virtually there's really minimal pain. So what we're doing with these needles is we're promoting circulation, we're lessening inflammation, and we're trying to force movement through there to actually get these things to heal. So the problems with tendons and ligaments specifically is that they don't have their own blood supply, and they take a lot longer to heal. And as we get a little older, that healing process slows down. So what we want to do is we need to force that circulation and movement through there. So of course we could lessen inflammation, and we could just put points in this shoulder right here and see if we can get things to move. But really, when you're coming into the office, we're doing treatment and points in other spots. So these are not the only places these guys actually get acupuncture needles. They'll get them in different parts of the back, because what we're doing is lessening inflammation as a whole throughout the body. We're really working on tendons and ligaments and strengthening them, not just in the hand, but also throughout the body, so that we can prevent injury. So I think a lot of people don't always think about us for prevention, right? A lot of people get so busy, and it's not until they have something that's hurt or they're irritated or it's actually impacting their daily life do they actually think about it. So prevention is huge for us too, and it's something that we'll always work on, whether you necessarily are coming in for that or not. We will always be doing acupuncture points to work on that. So for Michael Carley over here, we have local points because he did take a little bit of a tumble. But what we're trying to do is force circulation. So he'll actually have points that go up further into the hand. And then there are some points on the hand that may seem like they're just for local points, but they're actually huge anti-inflammatory points, and they work on lessening inflammation in the body. So that's something we're always working on. When you come in, we ask a wide array of questions, not just what you're specifically coming in for, but everything, whether things are impacting your sleep, whether they're impacting digestion, whether you have headaches, migraines, things like that, because we can work on everything at the same time. So that's our goal, is to work on your root cause as to why you have this issue, and then hopefully to get this not only to heal, but to prevent it from happening in the future. That's something that we like to do at the White Crane Clinic. I will say I've known Rebekah for 20 years, more than that, probably more than that. And we have been able to have such a great team. I want to say thank you so much to this chapter. I am in a BNI chapter that I love, but I feel like when I come here, it is like coming to my second home. I walked in the door this morning and everyone was like, oh my gosh, and I got so many hugs and I got so much love just by walking in. So thank you guys so much for all that you've done for me, for us, for our business. It really is huge, and I love seeing all of you on Thursdays when you come after this meeting into my office to hang out. I really do love it. I might joke that I can't get rid of you people, but that's really the hope, is that we never ever have to, except for Ron. And no, we love Ron. It's really been such a blessing, all of you guys. So thank you so much for continuing that, and for putting up with Rebekah. We love that. So
it's a tough battle.
It's not tough at all.
All right, that's it. She'll be around for questions after if you have questions.